Hello, I'm Dr. Rod Toms. I'm a general dentist in the dental health group. I do a significant amount of restorative complex cases, so I thought I'd do a few frequently asked questions about this type of work. I often get the question, what's the difference between a crown and a veneer? Well, for the most part, it's made of the same kind of material. The veneer is strictly an aesthetic component added to the tooth, and you need a strong, healthy tooth to support it. Nothing looks more beautiful than a nice set of veneers, for sure. A crown, made of the same material, is more involved with supporting a tooth that's either heavily filled or damaged in some way, broken. Anyway, it's a tooth that you couldn't put a veneer on it. There's not enough strong tooth to support it. They both have very similar effects in terms of the aesthetics. Very nice. Sometimes you do a combination of the two in a mouth. If some teeth need restoring and other teeth just need to look better, then you'd have a combination of the two. Another question I get is, when would you use an implant to replace a missing tooth as opposed to a fixed bridge? They both serve the same purpose, that is replacing a missing tooth. But the bridge involves restoring the teeth on either side of the space. And that's an attractive option if those teeth would otherwise require a crown or already have a crown. Then you're not losing any particular tooth structure to build it, because the main advantage of an implant is that it stands alone. It doesn't involve any other teeth in the restoration. So in a healthy mouth, an implant is obviously the #1 choice. Also, some people come to me for this type of work and they have an uneven gum line. They show the gums when they're smiling and so on. And we often use a laser to readjust the gum line so that it's more even, so that the tooth links all look pretty much the same. Another thing that we use as an adjunct to restorative dentistry sometimes is orthodontics, mostly Invisalign, to set the teeth in a more aligned position so that you don't have to be aggressive to restore them to make them all aligned at the end of the day. If you come and want veneers and you've got teeth that are kind of crooked, it's probably not a very good idea. You'd have to do a very, very aggressive treatment to the teeth to get the effect that you'd be looking for. So if any of these things are of interest to you, I'd invite you to give us a call and I'd be glad to discuss them with you.